It's been tough to reconcile what's happening with the coronavirus response at the national level with what's transpired here in Massachusetts. Nationally, we passed the 90,000 death mark today. You have the president's son reiterating this baseless theory on Fox News.
The Democrats are trying to milk this for everything they can. They think they're taking away Donald Trump's greatest tool, which is being able to go into an arena and fill it with 50,000 people every single time, right? So they will, and you watch, they'll milk it every single day between now and November 3rd. And guess what? After November 3rd, coronavirus will magically all of a sudden go away and disappear, and everybody will be able to reopen.
And the president regularly making this widely disputed claim.
What we've done in testing, we've now tested more than the entire world put together. The entire world put together, we have many more tests than they do, and better tests. And the reason we have more cases is because we have more testing.
So we have the best testing in the world. It could be the testing's, frankly, overrated.
Overrated? Conversely, here in Massachusetts, Governor Charlie Baker seems to be dealing largely with facts, just today becoming one of the last two holdouts in the country to announce details of a plan to reopen the state. It's 4 phases in all, although phase 1 comes in 2 parts. Manufacturing, construction, and places of worship are allowed to immediately open, and hospitals and community health centers can offer more high-priority treatments. Then a week from today, hair salons, pet groomers, car washes, lab spaces, retailers with curbside pickup, and most offices can open at no more than 25% capacity, with Boston offices not opening up till June 1st. But every business open in phase 1 has to comply with mandatory safety standards with policies on social distancing, hand washing, disinfecting, and what to do if an employee is diagnosed with COVID-19. The governor also modified the state's stay-at-home advisory to become one he's calling safer at home, with a lot of responsibility on individuals.
We are going to ask people once again to rise to the occasion as we continue to fight this virus. This guidance asks people to change behaviors, and it changes the way some of our favorite places look and feel. This is not permanent. At some point, there will be treatments and ultimately a vaccine. But for the foreseeable future, everyone needs to continue to do the right things.
That, of course, means keeping distance from others, face masks when social distancing is not possible, washing hands and surfaces frequently, and staying home when sick. Phase 2 will be at least another 3 weeks away and is expected to include more retail, restaurants, lodging, nail salons, and spas, with restrictions, of course. And Phase 3 will be just about everything other than large venues and nightclubs, with some restrictions there as well. But the reopening plans are not the only big news coming out of the state today. Cambridge-based Moderna announced early results this morning from a vaccine trial, which shows people are developing antibodies that are effectively blocking the COVID-19 virus from infecting other cells. It's a lot to take in a single day. So joining me to talk about it all is one of the top public health experts in the country. Dr. Ashish Jha is the director of the Harvard Global Health Institute. Doctor, it's good to see you again. Thanks for being here.
Thanks for having me back.
So Massachusetts is testing more per capita than the vast majority of states in the country. Are we doing enough testing to have begun reopening today?
Yeah, so we're still pretty far behind where I'd like for us to be. And that's because while we do have many more tests per capita than most places, the problem is that we also had a bigger outbreak than almost any other place. And given the size of the outbreak, we need a lot more tests. So, as we begin to open up slowly, as long as we can keep ramping up testing, I think that'll be really, really important. If our testing flattens out where we are right now, we're going to end up getting into trouble for the upcoming weeks.
So would you have advised Governor Baker to wait till the testing was at a higher capacity to have announced what he did today or not?
It is always a balancing act, right? And I know that people are anxious to get started. My feeling is if more testing is coming soon, I'm comfortable with the very minimal, the manufacturing and other kinds of opening we have now. But before people really start heading outside and going to restaurants and interacting with each other much more aggressively, I'd like to see a lot more testing in place.
How are we doing on the national level? There are places like Texas, for example, I'm sure you know this, yesterday had their highest case number after having opened on May 1, and the argument from the governor is the reason why we had so many new cases is because we have doubled our testing. One, is that true? And two, how are we doing in the lower 49?
Yeah. So overall, I think we've made a lot of progress on testing in the last couple of weeks. We're still not where we need to be by any stretch of the imagination, but we are better. There are probably a dozen states that are doing enough, but that leaves a good, 38, 40 states that are not doing enough. So what I've been saying to people is I understand it's a balancing act. You got to keep getting aggressive on testing and ramp up further. And I don't believe that the issue with Texas is simply that they're testing more. I think they opened at a time when they didn't have enough declines in cases, and I'm worried that they're going to see more spikes in the upcoming weeks.
I played for you a minute ago the president saying the entire world put together, we have many more tests than they do and better tests. What are better tests? Do we have better tests in the United States? Anybody else?
Not that I know of. I've looked at tests from other countries. I think they're pretty good, too. I think we have pretty comparable tests. I don't think ours are better.
Well, except in one place, they're clearly worse. These Abbott rapid tests that the White House is using, I read over the weekend that the false negatives, at least in one sample, were as high as 48%.
Yeah, so I think the false negative on the Abbott is probably a little bit lower than that. I've looked at that study too. It is a rapid test, but often with rapid tests, you end up having to live with a little bit of more imprecision. And I think the false negative rate on the Abbott will probably be closer to 15%, which is better. But that said, it's not perfect.
So staying on the president just for a second, and then we will move on. I don't know if you've heard in the last hour or so, the president is reported to have told a bunch of, some other people that he has been taking hydroxychloroquine. What's your reaction to that, assuming it's true?
Yeah, so I don't know if that's true, and I wouldn't, if I were his physician, I wouldn't advise it. And the reason I wouldn't advise it is that there isn't any evidence that it would be helpful to him, but there is evidence that hydroxychloroquine, like many other drugs, can have side effects and toxicity. So I would not recommend that he take it unless there's a clear clinical indication, and preventing COVID is not one of them.
I have spoken to you a bunch of times, and I've followed virtually everything you've said about the need to increase testing capacity. I think we're somewhere in the 400,000 range nationally now. You have said 900,000 you think is sort of the floor above which we have to go. But then I read a piece in the Washington Post this weekend that I think was saying that our testing capacity is actually robust enough. The problem is not that, which is what I thought it was. The problem is not enough people are going out and getting tests. Do you buy the theory? And if you do, where are we failing in encouraging people to get tested?
Yeah, it's a bit of both. Here's the problem, right? When we were really constrained in testing, we told everybody, don't bother coming to get a test, because unless you're at death's door, you're not getting a test. So guess what? The message got across and people aren't coming in. And now that we have more testing capacity, there are people hanging out at home who should be getting tested. And there are other people who should be getting tested who are not getting tested because they still think there's a testing capacity problem. What will happen is, as we encourage those people to start coming in and getting tested, our numbers will go up. That's good. But we'll hit a new level of constraint again. I don't think we can get to 900,000 right now, even if everybody who wanted a test and who needed a test showed up. That said, there's definitely now a problem of a lot of people think they can't get it and therefore aren't coming in.
One more thing about a new development. I consider myself sort of a de facto distance student of yours on testing. Maybe not as good as your average student, but I'm learning along the way.
I think you're better than average, but yes, please, go on.
Thank you. I assume that if you test positive and then subsequently you test negative, that's the end of the game. And then I read again this weekend that there are at least 13 sailors on the USS Roosevelt, and people remember this is where there was big controversy about the leader notifying the public that there was a problem there. 1,100 tested positive at one point. 13 have tested positive a second time after having tested negative. What is the conclusion one draws from that in terms of immunity, and what is the advice one gives as a result of that about the need for continued testing?
Yeah, so I think we should not worry about immunity yet. The fear, of course, is those people were reinfected and they can get infected more than once. I'm not convinced that that's what's going on here. What I suspect is happening is one of two things. Either when they tested negative, it was a false negative. We talked about how some tests can have false negatives. So it might have been that. Alternatively, the second time around when they're testing positive, it may be that the test is picking up fragments of the virus, fragments of the viral RNA, but that these people are not actively infected. Most of the stuff out there tells us that people really do develop immunity, and that makes me pretty doubtful that this is a reinfection.
When you talk about testing numbers, and we're still nowhere near, again, that threshold, are there moments where you say to yourself, we may have to accept defeat here and focus more on containment or harm reduction or whatever term your colleagues use? Do you have those moments or no?
No, I don't. I'll tell you why, Jim. I'm very optimistic that we will get to the number of tests we need and actually surpass those numbers. Not in the short run. I mean, short run really requires aggressive federal leadership. And I have come to conclude that we're not likely to see that anytime in the next few weeks. But we have, what makes me optimistic is there are all sorts of new types of tests coming online, new modalities, antigen tests, sequencing, and those will let us get to millions of tests a day, even without White House leadership on this.
Okay, so let's test your optimism before you go. We learned this weekend that Moderna, which operates about a mile down the street from where I live and not far from where you work, had 8 people in their clinical trial who developed antibodies after having taken the first phase of a vaccine. 8 people develop antibodies, and it changes the mood of much of the world. Well, not to mention the stock market going up 1,000 points, give or take a few. Are people overreacting in a positive way to that news, or do you think they're onto something?
So, look, people are just looking for good news right now. And I was pretty happy about the news, but I think any happiness here has to be tempered with realism. What made me happy was the idea that, okay, it looks like we can stimulate immunity. Am I convinced that this is the vaccine that's going to get us all the way there? I'm not. There have been long histories of things that look pretty good in phase 1, phase 2, even phase 3 going into phase 3, but don't end up panning out. So I'm not betting on this one per se. What this did for me was made me more confident that eventually we will get a vaccine. And that makes me feel better.
So if you're not betting on that, would you bet on the president's prediction the other day that we'll have a vaccine as early as December of this year?
It's very hard for me to see how we are going to have large numbers of safe, effective vaccines by December. I mean, miracles happen, and especially in December, it's the month of miracles. But that said, I am looking at 2021, and I'm probably thinking mid-2021 as the realistic, if everything goes well, we'll have a safe, effective vaccine that's widely available.
Here's to miracles, Dr. Jha. It's great to see you again. Thanks so much for your time, as always.
Thanks for having me on.